Before I got my job here, I actually worked for a fast food company. And so insurance was offered through the company, but I couldn't afford it. It would have been roughly 20% of my take home pay. And so at the time, I was supporting 3 children by myself. Of course, I had my normal bills, rent, car, et cetera, et cetera. And I brought home, if I was lucky, around $1,000 a month was what I took home. I worked full time, 5 days a week. And so I didn't have insurance, I didn't have routine medical care. And so if I had something arise, I took care of it by going to the emergency room. And so I started getting sick. I actually was sick for quite some time, and I passed out at work. And so they insisted I go to the emergency room. This had been my 4th visit that month to the emergency room for these symptoms. And they finally did some blood work and found out that my liver enzymes were really high. So they did an ultrasound. It turned out my gallbladder was full of stones, that it looked like that it was going to burst. And since I didn't have insurance, I couldn't have the procedure done. I couldn't have my gallbladder removed until it actually ruptured. So they kept me in the hospital for 2 days, hoping that that would happen, which meant my children stayed in daycare for 2 days. And it didn't happen, and I finally had to leave because I'm a single parent and I had to get my children. And so for the next year, I continued to be ill because I didn't have the $2,000 that was required for the surgery since I didn't have insurance.